Senator Murray. Senator Moran.
Mr. Chairman, thank you. Mr. Secretary, I don't think I'll call you Bob in this setting, but Mr. Secretary, thank you very much for your presence, as I said earlier. A series, perhaps, of convoluted questions, all related to the same topic. First of all, I'd like to offer my assistance, as I've done with previous secretaries. You have testified. The chairman of this committee has great interest in trying to help the VA have the necessary professionals to meet the needs of veterans. I've asked the previous VA secretary for how can I help? What do you need? What tools don't you have to help solve this problem with no response? So again, if there's changes in the law, programs that are necessary to encourage loan forgiveness, whatever the story is that would help you attract professionals, I'd like to be of assistance. I'd like to be an ally. Here's my scenario of a couple of stories. Lee Mann, as a Smith Center veteran, I mentioned him in my opening remarks, and he had the good fortune of the VA calling him to tell him that he no longer needed to drive 4 hours to Omaha, Nebraska from Smith Center, Kansas to have a colonoscopy. That's the piece of good news, so that suggests to me that there is a change afoot. Thank you. Down the road, about an hour in Plainville, Kansas, Larry McIntire tells me that last week he drove 3 hours to Wichita to get a cortisone shot in his shoulder. He goes to Wichita several times a week for other minor procedures. There is a CBOC within 25 miles of Plainville, but the CBOC doesn't have the professional capability, as I understand it, of providing cortisone shots. What does exist is a hometown hospital, Rooks County Medical Center, Plainville, Kansas, that could provide a cortisone shot that's in the same town as where Mr. McIntire lives, and certainly less than the 3.5-hour drive to Wichita. So on the one hand, we've had some success. On the other, there still remains these issues that we're trying to get at within the VA, but also in implementation of the CARE Act. First of all, in implementation of the CARE Act, when the 40 miles is the determining factor as to whether or not you can access health care, how are you going to treat what that CBOC is capable of doing in determining whether or not that veteran lives within 40 miles of a facility? Is it a facility, or is it a facility that can perform the service that the veteran needs?
That's a really excellent question. I'm glad you brought it up, because one of the technical changes that we're working with the committee on is to give the Secretary the authority to interpret that the way it should be interpreted. In other words, let's look at it through the lens of the veteran. Does it make sense for that veteran to get a cortisone shot closer to home? What makes sense? And one of the things we're asking is to give the Secretary that flexibility in the technical changes to the CARE bill.
You do not believe you have that authority to make that determination now?
No, sir, but I think just by simply putting in a phrase, it would be very simply handled, and we've been working that with the staff.
And does there seem to be any impediment toward accomplishing that?
No, sir.
Okay. Then